Genetics certainly play a role in heart disease and strokes in many ways. We have to remind ourselves that heart disease continues to be the #1 cause of death in the United States, about 1 million people a year. And genetics play a significant role. Maybe half of that risk has to do with what we inherit. Today we're talking about elevated lipoprotein A. It's a type of genetic cholesterol, meaning it's not about what you eat or your exercise that determines that level. It's really just inheritance from your parents. It turns out that about 1 in 5 people in the United States, or 60 million people in the US, have an elevated lipoprotein A, but less than 5% have actually had testing for it. So we have a real opportunity in terms of increasing on awareness and screening about lipoprotein A. LPA is a different type of cholesterol in that it increases inflammation, blood clotting, and development of plaque in your arteries, even more so than the usual cholesterol. So significantly increases your risk for heart disease. And at younger ages, we sometimes see people 20s, 30s, and 40s with heart disease with a high LPA. Now, who should be screened? Really, everyone should get an LPA tested. It's just a blood test. Particularly those with a strong family history of heart disease, those that have high cholesterol, those that have had a heart attack or stroke before. Go to your doctor, advocate, and ask for that test. If for some reason they're not comfortable or not familiar, you can go to the Family Heart Foundation website. It's LPA Awareness Month, and there is free testing available there. The Family Heart Foundation is the premier patient-centered organization, promoting research, advocacy, and advancing screening for individuals with high lipoprotein A. So really, they also can help connect patients to providers that need that information. So really a wonderful resource for all people that want to know more about lipoprotein A.
The Family Heart Foundation really has just provided a plethora of resources for me when I was diagnosed with high Lp(a), and helping me connect with providers so that I could figure out how to get care for myself and screening for all of my family members. My family history was very strong of heart disease. My father had a heart attack when he was 40. I lost one sister at 36 to heart disease, and then I lost another sister at 48 to a heart attack. So finding the Family Heart Foundation for me meant getting the rest of my family screened and connecting us to providers so that we could get the care we needed to do and have conversations with the rest of our family.
If you have an elevated LPA, what can you do about it? First and foremost, is really screening family members. If you have an elevated level, your parents, your siblings, your kids each have a 50-50 chance. So definitely get them all screened. What about yourself if you have an elevated level? Today there's no treatments available to directly treat LPA, but I'm pretty optimistic in the next 1 to 2 years, looks like we'll have those. But today, what do? You really double down on your known risk factors, your blood pressure, your cholesterol, your blood sugar, exercise, diet. These make a big difference and can really help lower the risk, particularly when someone has a high lipoprotein A. For more information, a great place is go to the website, findlpa.org.